the next person. Thank you.
Thank you so much, sir. Thank you so much.
Yes, ma'am. So, Dr. Arnab, you can go ahead.
Thank you very much, and good afternoon to everybody. And I really would like to thank Arokiam sir and Kiran sir, who have organized these things wonderfully. And Kiran sir has been for the last two sessions. I've been seeing him, and thank you very much. I know it's a very, very difficult job. And so just to say,
Thank you.
you're attending, you're questioning everybody, and it's really very impressive, and I'm very much privileged that Nazareth Magocius College has given me the privilege to present. So I'll be sharing my slide, and okay, so I hope my slides are moving.
Yes, sir. Okay. It's navigating.
Yeah. So the way back in the 1980s, computer information science decided to marry biology, and because under the blessing of economics. So they found that things became cheaper and easier. So always there was this money involved, and once this union happened, it was only a matter of time before AI came into being, before the artificial intelligence came. You started feeding them with all information, you started feeding your machine, started training them with lots of information which you already have, and then it started to make some predictions on some input data later. So this was essentially it. This was the beginnings. So whatever anybody says, that whatever happens, bioinformatics and AI, this was bound to happen. So the first thing which we see, that information science, bioinformatics and deep learning, they have regions of overlap. Whereas people working with AI, they know that deep learning is within machine learning, which is machine learning is the core to the artificial intelligence, and everything has got an overlapping. So I would consider AI as an offspring of bioinformatics. So in the terms of the biology, from the perspective of biology. Now, in biology, it has been seen that if you use AI, it does a lot of things, benefits. You have in the healthcare and the pharmaceutical industry, it has got an economic impact. It has got an impact in the agricultural field, livestock field. It has got impact in species preserving species biodiversity. You can predict which species is going to die out soon. So what you have to do to keep them alive. All these have got the blessings of economics. Maybe taxonomy, that is classifying organism into groups. This particular branch doesn't have the blessing of economics, but therefore people are not doing so much work on that. But essentially one aspect which I'll be discussing today, that is on the healthcare sector. So it was found that it reduces drug discovery cost traditionally over $2.6 billion in a year, and it is expected to increase by the year 2030. Pharmaceutical revenues are going to be increased by $50 billion. I've been working in a pharmaceutical company, and to get out of one particular drug, the research groups inside these companies, they work for 2 to 3 years, and till that drug passes all the health tests, it's not coming into the market. So billions and billions of dollars are spent into making one drug, maybe for one diabetes medicine, and then maybe 2 years later you can find it to be having some health complication, and it's removed from the market. So all the money is gone to waste. So this AI can give you certain level of confidence whether this particular drug, you can go ahead with it, whether you can spend your next $1 billion to get your next trillion. That is the particular philosophy behind it. Now, AI models, there are a lot of AI models. I'm not discussing about them. I'm actually working on these drug discovery timelines and AI models. So I just would like to bring out the essence of it. It reduces the drug discovery timelines and costs. So in silico, that is sitting on the computer, what I do, or what people do rather, they use AI for fast identification of drug candidates. Like so many of the lectures I've been listening today, this particular thing is not socially inclusive. People in rural areas or places where there are weaker internets, this in silico study, there is a huge digital divide over here. Then AI-driven platforms, they also identify toxicity levels and molecular interactions. In former times, what happened? People used to work a lot. They used to work and they used to get money. Companies used to invest in the hope of getting it. And then in the end of the day, out of 1 billion candidates, the candidates reduced to 1, and that after 5 years, they say that it's having some problem with the heart, so that medicine has to be removed from the market. That was the thing. Therefore, drugs were extremely expensive. Now also it's expensive, but we know the costs go to the medical representatives and the doctors. But actually you can get really very cheap generic medicines. It is being implemented in top companies in India right now. But most of these generic companies, they don't use it. They simply take a formula and make it. In India, most of the drugs are generic, by the way. So the next big thing is precision medicine and personalized treatment. I am a diabetic. I am now 50 years old. And I got diabetes since I was 35. So, I mean, I could have, through this, if I had gone through some precision medicine and personalized treatment at the age of 20, I could have predicted that I would have had diabetes at the age of 35, and I would have taken this step. Personalized medicine would have helped me to go to, that 35 would have been delayed to 50. What I need to do to get my diabetes at 50, it could have helped me. And precision. I am allergic to certain particular compounds, yet the doctor gives me this medicine because that is the particular medicine available right now which doesn't have side effect, but to me it has got a side effect and I have to live with that side effect. This metformin which I take, always my stomach is queasy with this medicine, but that is one of the best medicines and that is the least harm which can happen to my body. So this precision medicine, if you have the genetic information, you feed it to it, your AI is going to predict you that these are the medicines at what stages of life, how you will be infected. So now this brings into effect some ethical challenges. If my genetic data, genetic information is in the database, it can be misused. Like any science, people we still think that AI, am I cheating? I'll be very honest, I made this presentation on AI. I fed ChatGPT my data, my research, and it simply beautifully it made a latex code, and that code I pasted an overleaf and I got this beautiful. I made a little bit of manipulation. It saved me hours of work. But if this particular, it can be misused. Such data, my data can be taken, like your bank account, your credentials, all this information, if it's in the market, there has to be a huge amount of cyber security so that my bank information is safe. Similarly, my genetic information is my right only, nobody else's has got the right to use them. What my genes say is my information. So there is an ethical challenge. I just put it and immediately, once you put it on AI, it's going to go to places for interpretation. And then you have got an algorithmic bias. As human beings, we have the biggest thing, a flaw which we have in science is a bias. We are tilted towards thinking, at the moment we are tilted towards thinking, AI is great, but using AI, People will become dumb and stupid, and they will forget about creative writing or creative thinking. Well, the same problem happened when calculators were first introduced. They used to calculate by hand. People in the fish market, they can calculate just by mental power. They don't need any calculator to make it. But calculator has integrated in a society, and we are still capable of creative thinking. Similarly, computers, they do all our work. I believe AI is also going to evolve to such a level that it's a part of our life. Artificial intelligence is part of our life. I sit in my home and I tell my refrigerator to put the temperature down. It happens in the US. So we can do all these things. But it's going to be a part of life and not necessarily making us stupid. And then you have intellectual property and data ownership. So there are the blockchain-based models to address these ownerships. There are several researches which are done, and many people have talked about this in 2 sessions back. They have talked a lot, so I'll not go much into details about these parts. And the future prospect is synthetic biology. So our biology, we will first synthesize them in our computer. We can make our fuels, we can make our bioplastics, we can make our pharmaceuticals all in the computer. We can design what our particular metabolic pathway is, how we can manipulate. Say this particular pathway has been modified by this medicine, so other pathways are infected. How we can control that? So what is the impact? Everybody will know that impact, the precision. When you take this drug, what happens? Right now, doctors say by experience. Then doctors will have a basis to say something. But these types of software should be only in the hands of doctors, not people like me. Then AlphaFold's protein prediction is driving forward how to synthesize a particular type of protein which is going to counter a particular type of a health problem which I have or anybody has. So it's going to be very personalized. So it will require engineering, biology, systems biology, bioinformatics, mathematics, chemistry, biotechnology to be working along it. I personally, in the University of Edinburgh, I worked for a few years as a postdoc in systems biology, where we could model the human sleep-wake cycle. We could model it on a computer. It's just like the modeling which you do in economical modeling which you do in economics. Similarly, we could actually make a formula that with including all the parameters, how our sleep cycle can be changed. So that's a long time back. I'm talking about something like 15-20 years back. So data privacy is also a very important aspect. And finally, to conclude, AI is set to revolutionize drug discovery, precision medicine, and agriculture. Ethical challenges in data privacy and algorithmic bias must be addressed. Stakeholders need to be clear, transparent regulations. Now, making this regulation is the real job. How do we, somebody like Donald Trump comes in and puts a different view of the world. Somebody like Biden will come later and then he'll put a different view. So it should not, so nobody should be able to change these ethics once they're established. So, and future of AI in bioinformatics requires global collaborations across industries and government. In the end of the day, it's nuclear power. You can use it to kill, you can use it to save. Thank you very much.
Thank you, sir. It was really wonderful listening to you. The length and breadth of AI in bioinformatics. I specifically don't have any question per se, but then if I have to give my opinion on the based on observation, if you look at India's travel journey regarding bioinformatics, the graph stands large. And especially regarding biotourism, India stands top-notch in terms of offering quality medicine across the globe. It is also very cheap. But the problem here is, what kind of a potential will India lead towards its domestic market? That is another problem. So all these things are extra worrying factors that causes stress among the population.
There comes the function of economists. You make a drug, you make a solution, and for example, my father has got a heart problem. He had a bypass surgery, everything is blocked. Now his condition, he can't have any more bypasses or stent. He needs to have it has to be medically managed. And there is a good medicine, and its prices, he has to take it every 6 months. It's 1 lakh rupee per injection. Is it possible for a teacher who gets nearly 1 lakh salary a month to just give a medicine like that every 6 months?
I get.
You bring it down there. We have generics. So somewhere our greed must come down and our need must go up. And perhaps economists do this better. They entice people that if you follow this model, if you reduce it, you will earn more. They can work hard on these models. My wife is an economist, and therefore she's telling me that we can solve these problems. Well, let's see how things progress. But I feel that AI is going to be a part of our life without, say, like this computer, like my mobile is, it's a part of my life. It's a part of the life. Still there is the divide, but this divide will move. Now see the number of people having smartphones in their hands. It's going to be there. And it's going to come to people also.
Sure. Thank you, sir. It was very nice listening to you. Your enthusiasm and the passion to deliver information. Thank you, sir. Thank you. Pleasure listening to you.
Thank you.
Thank you, sir. Upadhyay?
Yes, sir. Am I audible?
Yeah, you're audible. You can go ahead.
First of all, thanks for giving me this kind of opportunity. And you guys are doing a great job. And it's so good to be here. So let me show my presentation.
Upadhyay, one more comment before starting. Since we are also running out of time, can we keep it short so that you can reach your research questions and then the solutions towards it, and finally the conclusions?
Okay, so okay, done. Okay.
Yeah.
So should I share my presentation, or it will be okay?
Yeah. Go ahead. You can share.
Okay. Is it visible?
Not yet. It's still black, but then your screen is visible. It says infinity mirror. So maybe you can stop. Yeah.
Give me a second.